Good morning. It's Ashley with another Hampton Roads Perspective. And this morning I'm here with Dr. Joseph Frenkel from Secours, surgical specialist. How are you today?
I'm great. How are you this morning, Ashley?
I'm great. Thank you so much for coming in. And we're going to get right to it. You came in today to talk about one specific thing. And what is that?
Colon cancer. I'm a board-certified colorectal surgeon. I work with Secours. My offices are in Suffolk, Virginia. And I'm here to talk about colon cancer because there's been a new focus on colon cancer over the last 10 to 15 years because colon cancer is preventable and because we've been doing a lot with colorectal cancer screening to try to prevent cancer before it develops.
I actually just read an article that said it used to be 50 years old for people to go in and get a colonoscopy, but now it's 45. Is there a reason for that?
You have done your homework,
yeah,
Ashley.
I got a news alert on my phone yesterday. I'm like, oh, this is perfect.
This is a very, very new American Cancer Society guideline, which just came out, which is taking the starting of screening for colorectal cancer down to 45 from 50. And the reason for that is because there has been a recent trend for younger patients to be developing colorectal cancer. And so they're moving the guidelines down to starting screening at age 45. Now, that's a very new thing, and it still needs to be delineated how your insurance companies are going to respond to that recommendation, but it's on the horizon.
Now, for our listeners that might not be very familiar with colon cancer, can you tell us what exactly it is?
Sure. So colon cancer really is colorectal cancer. Your colon and rectum are the last parts of your gastrointestinal tract. And generally what occurs is there's an overgrowth of tissue there, which forms into a polyp. Now, these polyps, if left to continue to grow, can degenerate into colon cancer. And at that point, you have colon cancer. So what we try to do is find these polyps before they turn into cancers and remove them. And that's the benefit of the colonoscopies that we do, is to remove these polyps before they turn into cancer.
And what are symptoms of colon cancer? Are there any symptoms or signs?
Certainly. Bleeding, abdominal pain, weight loss, difficulty tolerating your diet are all common symptoms of colon cancer. I will say that by the time that those symptoms arrive, people can have relatively late cancer. So what we try to do is colon cancer screening, not diagnosis. And the difference is in screening, we're actually taking patients who don't have any symptoms, and we're looking to see if they have any of these precancerous lesions so we can remove them and prevent the cancer. And that's the far better way to go, which is why we really encourage everyone to get out there and talk to their primary care doctors about whether or not they're a candidate for screening without any symptoms so that we can prevent the cancer from occurring in the first place.
Now, I was going to ask, when should you see a doctor? But I'm assuming, like what you just said, you should get screened before you even have a symptom just to be on the safe side, correct?
Correct. So just like in things like breast cancer, we're looking at things like age. We're looking at predispositions and risk factors. For example, a family history of colon cancer. We're looking at things like that to decide on when to start screening. Generally, people have been starting to screen for colon cancer at age 50 unless you have a family member who's had colon cancer in the past, and then it varies and it might be a little earlier. And that's the kind of knowledge you can absolutely get from your primary care doctor, a colorectal specialist like myself, or a gastroenterologist.
Now, what other risk factors are there for colon cancer?
Aside from age, as we get older, there's more of a risk of cancer. There's also risks like family history. There are certain gastrointestinal disorders like ulcerative colitis and Crohn's disease, which also will increase your risk, and those people are screened at different intervals than the general population.
Is diverticulitis a risk factor for colon cancer or no?
It's not a direct risk factor, but very often when patients have diverticulitis, we will ultimately recommend a colonoscopy because very infrequently, but occasionally, patients who have diverticulitis, we think they have diverticulitis based on the way things look on our imaging studies, but in fact, they can masquerade as cancers. So generally speaking, people with diverticulitis will eventually have a colonoscopy as well. And then some of the additional things we talk about, which are a little less tightly associated with colon cancer are diet and lifestyle. And it's very difficult to study these things because basically it's hard to isolate out something like red meat when there are so many different variables in people's lives. But red meat has had a loose association with colorectal cancer, so lots of red meat in your diet may give you increased risk. A very high fat diet, obesity, alcohol, smoking, all of these things can increase your risk of colorectal cancer.
Well, how can you reduce your risk for colon cancer?
Avoiding maybe some of these things we talked about, like certainly smoking, excessive alcohol, staying fit, maybe minimizing your red meat, things like that can help. In addition, really the gold standard is the screening that we're doing. And the screening is what we can do to try to get rid of these polyps so that patients don't show up in your office at age 55 with a colon cancer where it could have been prevented.
Yeah. Now, what does a healthy diet look like?
A healthy diet for the colon is high in fiber. We like fiber in the colon because fiber bulks up your stool. It gets the stool through your gastrointestinal tract and out your bottom without a problem. It may decrease your risk of colon cancer, and it certainly won't bring you to my office talking about how I'm going to remove your hemorrhoids next Friday morning. And that's certainly something you want to avoid. Trust me on that.
So high in fiber, things like
fruits and vegetables, whole grains, these sorts of things.
Okay. Yeah. Now, can colon cancer be caught early?
Absolutely. It absolutely can. And even if we find on a screening colonoscopy that you have a cancer, if it's caught very early, it is treatable and curable. And a lot of these early cancers are, the cure rates are very high. So if you're out there and you're worried what we'll find if we do a colonoscopy, maybe you've seen blood on the toilet paper a few times and you think it's hemorrhoids, but you're not sure. If we end up finding early colon cancer, we can remove that cancer with cure. And the way we're removing these colon cancer these days is progressed tremendously over the last 20 years, from large midline surgical incisions to the most absolutely high-tech, minimally invasive procedures you can find.
What are some of the new ways that colon cancer can be treated?
Well, colon cancer, the mainstay of treatment is surgery. Unless it's a very late cancer, very often we perform surgical resection. Like I said, we used to treat these cancers with large incisions. There was a very high rate of needing a colostomy after a lot of these surgeries, and that has improved tremendously. We moved from standard open surgical techniques to around the turn of the century to laparoscopic surgical techniques, similar to when you have your gallbladder out. And even further now, we've moved to robotic colorectal surgery. So all of these techniques are designed to create small scars, reduce your pain after surgery, get you out of the hospital faster, all while adhering to the same principles of removing these tumors properly.
What would you say to people who haven't gotten their colonoscopy yet?
I would say come out and get one. It's not as bad as you think. I talk to lots of people around the time of their colonoscopy, and a lot of them tell me the bowel preparation, which you undergo the day before surgery, which involves drinking a little bit of liquid and pooping, is not as bad as people say. The colonoscopy itself is no big deal. You will go to sleep and you will wake up and you won't even know it happened. And whatever happens under anesthesia stays under anesthesia.
Now, if someone wanted to get more information on colon cancer or a colonoscopy, where do you recommend they go?
Well, I think they can certainly start with their primary care doctor to find out about whether or not they are a person who should be getting screened yet. And certainly referral to gastroenterologists like my gastroenterology colleagues at Gastrointestinal Liver Specialists of Tidewater up in Harborview with me, or myself for any additional information.
Now, I always ask this question when we come to the end of an interview. Is there anything else you'd like to leave with Hampton Roads today in regards to what you've come in to talk about?
What I would love to leave everybody with is the same thing that we hear in all aspects of medicine, which is prevention is key. Don't go to your primary care doctor when you have abdominal pain and bleeding and you may have colon cancer. Go when you're supposed to go. These guidelines that have been developed by multiple societies are there based on evidence. And the evidence is colon cancer is preventable. Go get your colonoscopy. You won't believe how easy it is.
Well, thank you so much for coming in today.
Thank you very much, Ashley.